not the same Neutrogena product that you're going to be receiving at your drugstore or out there in the grocery in the mall. This is the professional line. This is an incredibly high quality, not that the other isn't, I don't mean that, but this is a professional division of Neutrogena that we love to share with you and helping you get incredible results. And we're going to talk all about the line in just a second, of course, with our guest, Dr. Will Kirby. But before that, we also want to share with you what's going to be coming up in just a little bit from right now. We have available for you today only a shopping channel exclusive on the Neutrogena Dermatologics Retinol NX Serum available for you, and that pricing is extraordinary. A little goes a long way when it comes to the Neutrogena Dermatologics as well. It is very, very potent. We've sold over 2,500 of this particular serum since April, so a lot of you loving it. And of course, the entire line is focusing on that cutting anti-age technology, and also, of course, with the retinol and really specialized ingredients as well that are going to be in each and every product. So we'll talk about that, and of course, the great results you're going to be getting with our guest, a board-certified dermatologist, who I'll introduce in just a minute. I'm getting a little ahead of myself. Here we have for you from Neutrogena Dermatologics. This is the Retinol NX Eye Cream available for you, launching, I believe, today here at the shopping channel as well at $50 or 2 payments of $25 as well. And as we mentioned, this includes for you the patented stabilized retinol and additional unique ingredients in every single product. So you're going to be getting great results and helping with the 6 signs of aging around the eyes. We'll talk to Dr. Kirby about that as well. And as we mentioned, he is a board-certified dermatologist working out of Beverly Hills. I just have to share, if you don't mind, I'm going to sing your praises for a moment.
Okay,
because
I love that.
Hosts also NBC's Love Shack, served as medical correspondent on Extra. You even did a bit of a stint on Young and the Restless as well.
I did.
You do have movie star chiseled looks, chiseled features.
Thank you very much. Flattery will get you everywhere, so thank you.
And currently appears as the featured physician on E! Entertainment as well.
That's correct.
Is that correct? Wow, we're really pleased to have you here.
Well, thanks for having me. I appreciate it. Nice to see you.
Nice to see you. It's a pleasure to have you here, Dr. Kirby. And now, as I said before, but the Neutrogena Dermatologics, that is a separate division from the classic Neutrogena skincare that we love, right?
Neutrogena Dermatologics is the specialized professional division of Neutrogena. What that means is it really focuses on that unique partnership between scientists and dermatologists, and they set aside a goal, and that goal is to bring cutting-edge technology. So we talk about real-time results that you can really see in your own home, and that's exactly what this product line does.
Well, and we were hearing a lot from a lot of you about the benefits that you're receiving, because this is the only place in Canada to get the Neutrogena Dermatologics collection.
That's correct.
And this particular product is launching, as we mentioned, here at the shopping channel today for the eye area. Would you say one of the earliest areas that we start seeing aging is around the eye area?
100%. You said, would I say one of, and it's not one of, it's absolutely the first area of aging.
Okay.
And the reason for that is very specific. It's because that skin around the eye is the thinnest skin on the entire body. So as a result, Canadian women in general, the first area that they notice aging is around the eye. And people say, well, I ask them all the time in my office, I say, where did you really notice that aging? And they say, in photographs, or one day I just caught a look at myself in the mirror, and the skin around my eye just didn't look as young. And it really sort of aged me in the sense that I don't feel young, and I don't look young. I mean, I don't feel old, and I don't look old overall, but that skin around my eye really tells my age.
Well, that's true, and that can be, you know, in your 20s, your 30s, if you start seeing maybe the first signs of the aging around the eye.
Absolutely.
Does a little go a long way?
That is completely correct. A tiny little bit, a tiny little dewdrop size amount, or much smaller than a pearl, is enough to treat both eyes.
Is it both eyes?
Yeah, absolutely. Now, one of the things that I really want to touch on here is, and I always preface any discussion I have with any patient in my office by saying that the word doctor is derived from the word doctorate, which means to teach. And that's what I love to do. I love to educate, and I love to teach patients. And that's really important here. The reason being, we're not just talking about that delicate, thin skin around the eye. We're talking about 6 specific areas of aging around the eye. The fine lines, crow's feet, the lines of expression, under the eye circles, and even dryness. So those areas under the eye are specific areas that we concern ourselves with when we're discussing anti-aging. Superior anti-aging benefits, smoother skin, softer skin. That's exactly what this product gives you.
Now, does this also have the patented stabilized retinol technology?
It does. Patent stabilized retinol technology is an imperative part of any anti-aging regime. That's not just my opinion as a board-certified dermatologist. Ask any dermatologist, and they will tell you an anti-aging regime starts with a broad-spectrum sunscreen every single day, and the next step is stabilized retinol, and you have to be compliant. You have to use it every single day.
Okay, well, and that can make the difference. Now, retinol, when I think of retinol, I think of something that might be very strong, and would that be okay to use around the eye area?
Well, I'm glad you brought that up because there's a lot of misconceptions about retinol, and what you just said there is exactly what a lot of people think, and that is absolutely incorrect.
Okay.
The stabilization process in retinol has really taken place through some of the advances that Neutrogena Dermatologics has made. There's 17 patents associated with the stabilization process with this product, and as a result, it's incredibly well tolerated. So people who have skin like myself that's very forgiving, skin that's very oily, those people obviously tolerate it very well, but even patients with the most sensitive
like
of skin
me,
tolerate this very well.
It's sensitive, so that's okay for round.
Well, it's imperative. It's much more important than just okay. So the stabilization process that takes place in this product, that's why it's so incredibly unique, and that's why you get those great benefits from the retinol technology. And once again, it's not just my opinion. Ask any dermatologist. They will tell you stabilized retinol is imperative.
You know, that's very true. I've been chatting with a dermatologist myself in the Toronto area, and retinol, as you said, stabilized retinol is very important, very crucial.
It makes all the difference there, and the reason is there's a real specific reason. Once again, when we go back to education, the skin adult cycle is on a 35 to 57-day cycle. What that means is a cell that's born today is going to slowly slough off over the course of 57 days. Now, if you look at a child, you look at a brand new baby, their skin is beautiful. It's flawless. Why? Because that skin is rapidly replicating. It's rapidly sloughing off. It's rapidly being born, rapidly going through that cycle. But as we age, that process slows way down. So what do we want to do? We want to speed it up. And that's where stabilized retinol technology comes in. There's actually a little graphic, maybe we could show it. It kind of illustrates how the technology works. And but a pearl size amount, the size of a pearl is enough to apply over the entire eye area, and that's why we want to increase that surface cell turnover, diminishing the look of those fine lines and wrinkles.
That's true. That one little piece did the whole back of my hand.
Oh, absolutely. Now, if you look at this graphic here, imagine that as a fine line, a wrinkle. You could even think of it as dryness, some of those dark under the eye circles. Increased surface cell turnover is what that stabilized retinol technology does to diminish the look of those fine lines and wrinkles. But better yet, this product, it's not just that stabilized retinol technology. It also has stabilized vitamin C as well as biopeptide CL, which are other added ingredients that really help those 6 signs of aging around the eye and translate directly to you as superior anti-aging benefits.
Well, and maybe we could take a look as well at some of the before and afters that
I think I'd love to do that.
And share with everybody. This is after 8 weeks. Wow.
Yeah, I almost feel like I shouldn't even say anything here because the results are just so powerful and they speak for themselves.
That's impressive.
Absolutely. I mean, if you look under the eye, you can clearly see that the dark circle is diminished. In fact, there's a crease under there if you look at your left side photograph compared to the right, and it's just a whole lot more plump, a lot more supple. There's a sense of volumization that in this when you compare the pictures.
The crow's feet at the side are almost invisible.
Absolutely, significantly diminished, and also the wrinkle above the eye is diminished as well. So when you talk about those 6 signs of aging around the eye, how does this product benefit you? Well, it diminishes all 6 signs, and then it gives you superior anti-aging benefits, and that's why people have been so very pleased with it.
Wow, and the 6 signs again are the crow's feet?
Crow's feet, fine lines, the lines of expression, under eye creases, dark circles, and dryness.
And all of that can be addressed with the Neutrogena Dermatologics that we have exclusively here at the Shopping Channel for you in Canada. As we said, this is the professional division of Neutrogena. Many of us over the years have loved the Neutrogena line as we're growing up, as teenagers in our 20s or 30s, and now we're starting to see that aging process either start to happen, or we're well into it, or maybe we're in our senior years. Is this something that we can use no matter what age? Could we be proactive with this?
I'm glad you asked. Everything that a dermatologist tells you should be backed up by scientific data, and that's exactly the case here. Now, a study was done, and it was between the ages of 35 and 60, and all age groups showed benefit with this product. But I'm annoyed that it was only 35 to 60 years of age, because the truth is people get benefits in their 70s, in their 80s, and their 90s, and we start as young as 18 just to prophylactically treat what we think are going to be aging problems around the eye. So even though we look at this small window, this small study, the truth is that study quantifies 35 to 60 years of age, worked beautifully for all age groups, but I recommend it anywhere from 18 up.
Okay, so, and you know what, it's so true. I mean, take a proactive effect when it comes to your skincare. I mean, start young. And is there, as a dermatologist, I mean, you would know this, if we start young, does it pay off dividends down the road?
Of course. I always tell people, I'm 37 years old, and people tell me all the time that I look younger. And I tell
you
people,
do look younger.
Thank you. I tell people all the time, you really have to take a proactive approach. I love that phrase you use, to your skincare. You have to start early. If you're waiting until the signs of aging or have presented themselves, it's absolutely fine to start an anti-aging regime at that time. But and you should combat it. You should actively take the steps to fight it. But by the same token, there's absolutely nothing wrong with starting early when you first start to see those signs of aging around the eye, or even when you first start to worry about them.
It's like a healthy diet. You know, if you start young, it pays dividends for a lifetime, right?
It's like going to the gym too. You know, and that's a great analogy here, because a tiny little bit every single day is the way that this product works. Just like going to the gym. If you go once a month, you're not really doing yourself much of a benefit. But if you go every single day for just a few minutes, that's where you really get the health benefit over time.
A friend of ours here at the Shopping Channel used to say, a tortoise wins the race when it comes to fitness. That was his point. But the same would be the same with skincare.
Of
course. A little bit every day. The consistency, the continuity is very important. So getting in on the eye cream and using this on a regular basis, whether you're 25, whether you're 85, you will see benefits. You will see a difference. And we encourage you, even if you have a question, we have a dermatologist here in the studio. I mean, how often do you get to call and talk to a board-certified dermatologist and ask him directly, will this work for this? Will it help me with that? So this is your opportunity to call us. Don't be shy. Or you can call, and of course, our producers can ask the question for you, not a problem. We have had a question, though, about application, I understand. Where do we apply it? How close to the eye should we be getting?
Excellent question. This product is, not only is it dermatologist tested, but it's ophthalmologist tested. And I tell people there's a common sense caution that comes along with that. You shouldn't put it directly on the eye, obviously, but you can put it right up to the edge of the eye. So it's absolutely ophthalmologist tested for that, and that little tiny dewdrop amount, that droplet amount, less than a pearl size amount, is enough for both eyes. A very, very little goes a long way because of the concentration of that stabilized retinol technology.
Do we put it on the eyelid? Or
100%. If you see that before and after picture, and maybe we'll call that up again at some point, if you look at that above the eye crease, it is diminished quite a bit. The areas where you would absolutely expect to use it, in the crow's feet area or under the eye, you can absolutely see a benefit. But even on that upper crease above the eye, that you see a benefit there as well. So to the entire eye area, a tiny little bit. I recommend using during the day. That's when I think it's most easy to apply it. The other thing I like to stress to all my patients is this is a it's not a cover-up. It's not a makeup. You're absolutely getting real ingredients in here. You're going to see real results, and as a result, it should be the first thing that comes in contact with your skin.
So yes, and that many times we've had that question. What goes on first and so forth. This around the eye area would be the first thing on clean skin.
On clean skin, you can use any pad of your finger. I recommend the fourth finger. It's just a very, very soft pad. Dab, 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 dab to the entire area. And you'll notice it's very luxurious. It's very satiny, very silky. It absorbs very nicely.
Do you use this product?
Of course, 100%. I tell people I'm the least hypocritical dermatologist you'll ever meet. The same products I recommend to the patients are the same products I use myself, because I have access to the best products. And I tell people, if you come to my house and open the medicine cabinet, I keep things really, really simple. Broad spectrum sunscreen every single day, and the products from Neutrogena Dermatologics.
Well, and that's a good point, because, you know, a lot of men out there, we focus our delivery a lot of times to the women, but there are a lot of guys out there too that obviously want to put their best face forward for for a lifetime.
Sure.
And this is a great way to do so. Having, again, those anti-aging properties. I mean, we're never going to be able to stop the aging process, but we can help slow it down. We can help to make ourselves look the best at whatever age we're at, and having the great ingredients, and having, again, that patented retinol technology, that stabilized retinol, which, as you said, as a dermatologist, I mean, that is the one ingredient that is going to make a visible difference in our skin.
It's so imperative. There's more than 2,800 publications that speak to the gold standard anti-aging ingredient, which is retinol. So it's really widely known. The problem is, all retinols aren't created equal, and most retinols aren't stabilized, and that's why this patented stabilized technology really comes into play here.
Can you touch on that a little bit, because I think some of us, myself included, with the fair skin that reddens easily, kind of want to step back a little bit from the retinol. We've had some experiences that maybe...
Absolutely. It's so important to realize that some of the ingredients from the past that have been known to work weren't very well tolerated. And the truth is, now we have a much better understanding of how they work, and we also understand how they can be created and manufactured in a more stable way.